right, guys. Well, we're going to pick up right where we left off. Last time we had just finished Lyme disease, and this was the last disease we looked at in the chapter on cardiovascular and lymphatic diseases. You probably realize I picked very few diseases from that chapter, okay? But again, just as you're going through, make sure you're only focusing on the diseases we're covering. We cannot possibly cover them all. No, I would never make you match Lyme disease with cardiovascular, staph infection with skin. It's more important to know the name of the bacteria that causes it, how you get it, what are the hallmark signs and symptoms, what makes you know is it that disease. That's what I really care about. Okay? All right. So now we're ready to move into the next series, which is the diseases of the respiratory tract. Now, how do you think we're going to be transmitting these diseases of the respiratory system? Mainly droplet form, some direct contact we will see, but most of these are going to be spread simply by breathing on each other, sneezing on each other, because they are going to infect the regions of the nasal passages and the upper regions of the digestive tract as well, just because they're shared between digestive and respiratory. Okay? So we're going to start with what is probably one of the most common generic respiratory diseases, but because it's common and generic does not mean that it's a simple disease and that it's any fun. So we're going to start with streptococcal pharyngitis. Okay, that's the fancy way of saying strep throat. Now, I am actually a very lucky person. I have never in my life in 30 years had strep throat. Okay? But most people would probably not fit into that category with me. Almost everyone has had strep throat. The reason you've all come in contact with it, or at least know someone that has had strep throat, is because it is extremely contagious, and the signs and symptoms are very, very obvious. This is not just a regular old sore throat. When you have an actual Streptococcus pyogenes infection in the back of your throat, it is excruciatingly painful. The bacteria really goes to town, grows fast inside of the oral mucosa, really gets the immune system mad, and the immune system starts inflaming. The last name of that bacteria, pyogenes, and when you hear pyo, you should think like pyro means fire. This bacteria is known for giving people extremely high fevers. And that's generally the way a doctor's going to know you have strep throat and not just a sore throat from something like sinus drainage or anything like that. If you have a really bad sore throat and you're running a fever, they're going to stick that swab way in the back of your throat and start rubbing around because they're almost certain you have strep throat. Okay? Really? Well, then you had it bad, probably. They generally say strep throat does not occur in very, very young children, but I think a lot of that is because they have to get to the age where they're interacting more, talking to each other before they really start to spread it. There's nothing about this bacteria that's going to make it where a baby can't get it. It's just, babies don't generally drink after you. They have to get into their ones and twos before they really start doing those sorts of activities. All right? Now, if you get strep throat, you can take antibiotics, it's easily curable, and all the signs and symptoms are reversible, meaning it's not going to have any permanent effect on you. Now, a lot of people, once they get it once, keep getting it over and over and over again. And that can be because it lives in the tonsils. This bacteria can get into those back tonsils and start hanging out. It's a really common cause for people that have to have their tonsils removed. Now, when you look at this picture, and I know it doesn't look very impressive, and that's because to an untrained eye, it doesn't look very impressive. But it is much redder than the back of a throat is supposed to be. The back of the throat is supposed to be a lighter colored pink than the tongue. So it appears very, very red and inflamed. Okay? Now, so that's the most common, more simplistic one. The extreme of that would be an infection by a different bacteria called Corynebacterium diphtheriae. This causes the respiratory disease diphtheria. Now, none of you have ever had diphtheria, right? And that's because your DTP vaccine, we've already talked about the T, the tetanus part of it, the D, it protects you from diphtheria. So this is something we have pretty much wiped out of our population because we started requiring those DTP vaccinations, right? What if you were to get this bacteria, what it would do to you, the bacteria gets into your tonsils, spread respiratory, right? Gets into the back of your throat, gets into your tonsils. Well, when it's in your tonsils, your immune system kills the bacteria. And when you kill the bacteria, it has a nice little toxin in the cell wall of itself. So what type of toxin would that be? Endo or exo? Endotoxin. Endotoxin is the one that's inside the cell wall. So this little guy, he's one of those that says ha-ha to you. You kill him, and as you kill him, you release the toxin. So that toxin starts building up in your tonsils. Once it builds up inside of your tonsils, it begins to seep out of the tonsils, and it forms what they call a pseudomembrane on the tonsils. If left long enough, it will begin to spread, and that's what this picture is. This is the actual membrane from the tonsils that starts to spread and cover the entire back of the throat. Beyond that, I can't really describe the signs and symptoms to you because I don't know anyone that's ever had anything like this because it's something we've pretty much eradicated. But I would think if strep throat feels as bad as you guys say it does, that this is probably not going to feel real good. I would think that the patients would have a very hard time eating, drinking, so that's where you're going to lead to a lot of your hospitalizations and serious complications because people would lose the ability to eat, drink, and possibly even breathe if the membrane were to get big enough. So because you have tonsils not just in the back of your throat, you have your adenoids, which are your tonsils in the back of your nasal passageway. So any of those can be infected and get this same sort of membrane, not just the palatine tonsils, which are in the back of the throat. Okay? Pretty nasty, right? None of you ever probably really knew what the D was, but now we're all pretty glad we got that vaccine, right? All right? Now our next one is pertussis. This is the P of the DTP. Okay? Pertussis is commonly called whooping cough because of the very characteristic sign, this whooping sound that people have when they cough. And I have some videos to show you what it sounds like, but let me describe it to you first. The bacteria that causes pertussis is Bacterial pertussis. Now, any of you that have dogs, are any of those words familiar to you? Have you ever had your dog vaccinated against kennel cough? It's called Bordetella. It's the Bordetella vaccine. It is not the same bacteria. Okay, your dog can't get kennel cough and give you whooping cough. They're different bacteria, but they're in the same genus, the same family grouping of bacteria. But one is specific for dogs, one specific for humans. Okay? Bordetella pertussis is spread respiratory, just simply breathing, talking on each other. You don't even have to sneeze or cough on each other, just breathing on each other. Once that bacteria gets into your respiratory tract, it holds on, starts secreting an exotoxin. That toxin binds to the cilia of your respiratory tract. And that's what this picture is. It's showing you the bacteria holding on, constantly secreting the toxin. The toxin gets into the cilia that line your trachea and your larynx and your lower parts of your pharynx. Okay? Those cilia are constantly wiggling. Their job is to wiggle and produce a wave-like movement. The movement normally pulls any mucus up out of your lungs, out of your respiratory tract, until it can get to your digestive system where you'll swallow it, get rid of it. If you produce too much mucus or you don't have these cilia to help you get it out, you're forced to cough to get that mucus out. Okay? It's what people that have a smoker's cough, that's what they're doing. The cigarettes have toxins that paralyze the cilia, so they're constantly coughing trying to get that mucus up. Okay? So in this case, the bacteria secrete the toxin. Toxin paralyzes the cilia. The babies can't get the mucus out. So they're constantly coughing, trying to get it out. The whooping comes from they get to coughing so much that they have a hard time breathing because they're coughing so much trying to get the mucus out. So you get this characteristic, which is a very deep breath in between the coughs. And that's how you generally know babies have whooping cough. Now I keep saying babies because this is not something that an adult's immune system cannot commonly fight. Almost all adults have at some point in their life in the United States been vaccinated against pertussis. So if you come in contact with Bordetella pertussis, the bacteria, you'll have enough immunity built up from that old vaccine that you will not get the symptoms. But a baby that has never been vaccinated or not old enough to be vaccinated can get the bacteria. So I can be an adult that does not have whooping cough, but I could have some of this bacteria in my respiratory tract, and it's just not hurting me. And then if I get around a baby that is either not vaccinated or too young to be vaccinated, they can actually get whooping cough from me. You have a question? She got it from if somebody gets it at like 6 months old, they're getting it from an adult that's carrying the bacteria. A lot of babies die. The younger they are, the more likely this is going to be a fatal infection for them. It does, but it does not respond very, very fast to antibiotics. So if they're very young, you can't give them extremely strong doses of antibiotics. You can't give them the strongest antibiotics, and the bacteria is just so rapidly paralyzing the cilia. A lot of the babies end up suffocating because they're very sleep deprived. They can't eat because they're constantly coughing. So they have to put them in the hospital. They have to give them IV, food, fluids, everything they need because they can't eat. And if they are not properly taken care of, they're going to suffocate on their own mucus trying to constantly get it up. No. Right. It does not make the mucus. It just makes it where you can't get the mucus out. So I have two videos. And this first one is a 12-month-old baby. Or 12-week, I'm sorry, little bitty baby. This is probably pre-vaccination. Hang on, I'm going to have to turn this off where you guys can hear.